Because 7 million Americans are living with Alzheimer's disease. It is the sixth leading cause of death among U.S. adults. And despite these startling statistics, there is some good news on the horizon. The Alzheimer's Society reports 141 drugs are being tested in clinical trials, and of those, 78% are designed to slow the progression of the disease. Additionally, there are 3 promising drugs for treating people who already have Alzheimer's, and that is bringing hope and optimism to those who are living with the debilitating disease. Joining us now to discuss the latest research and medical breakthroughs is Dr. Leah Croll, Assistant Professor of Neurology at the Lewis Katz School of Medicine at Temple University. Doctor, I'm so grateful that you're joining us this morning. Certainly memory care is something that is a big conversation in my household. Millions of Americans are living with this disease. Do we talk about it enough?
Good morning. Thanks for having me. I love that you said this was a topic of conversation in your household, because I think really we don't talk about this enough. Most people know someone who's been affected by dementia, and more than that, it's the ripple effects that we deal with, the burdens that caregivers take on. I mean, this is just an immense source of stress, financial burden. There's so many different downstream consequences that we deal with when we talk about Alzheimer's, and so we should really be talking about this far more often.
And today's a good day to talk about it, right? I mean, this is the longest day of the year, and of course, the slogan, fighting the darkness with Alzheimer's. I'm curious, as someone who's just a layman, as a doctor, are you elated about the progress being made, but do you also want to see more talk about prevention?
Love this question. I am elated. Absolutely. It's so exciting that finally we're seeing some incremental advancements in a field where for decades there was just nothing. Research was coming up with nilch. So to be making progress, to be developing treatments is hugely exciting. But I'll tell you, as a doctor, as a neurologist, and as someone with aging parents, I am more excited about prevention and the power of lifestyle. In fact, there was a small clinical trial that came out just a couple weeks ago showing that intensive lifestyle changes can slow down the progression of cognitive decline in Alzheimer's. So this is something I think we really should explore.
And when you talk about the breakthroughs that are coming, you are excited about the treatment, and I want to ask you about that. And before I let you go, I also want to ask you about the caretakers, because we talk so much about the patient, but people who are suffering are also those ones who are taking care of the patients.
Absolutely. So, the treatments that are out right now are these IV infusions of antibodies that are designed to clear abnormal proteins that build up in the brains of people with Alzheimer's disease. These are not magic bullet drugs. They slow down the decline of the disease. They don't cure the disease. They don't stop the disease in its tracks. They do have some serious side effects, so they're not for everybody. But again, the more we learn about this disease process, the more there's going to be tools that we have that we can call upon to treat patients. When I think about something like heart disease, there's many drugs in my toolbox that I can use to help my patients with that. And I'm hopeful that in the future, we'll be looking at something similar for Alzheimer's.
Yeah, absolutely. Thank you, Dr. Leah Croll. We appreciate you today.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.